It is an absolute pleasure of mine to welcome all of you to this momentous occasion. So it's a significant milestone in the journey of both TACT and Red Health, and the TACT Academy for Clinical Training and Red Health joining hands today. We want to officially announce that Red Health will be acquiring a majority stake in the TACT Academy, one of the best known, the most illustrious, and the brand with the best legacy in the country for training in emergency medicine. And I'm assuming, Dr. Santil, we've trained almost 100,000 plus, right? There's not a city that I've traveled in India where I haven't met an alumni of TACT, and they all spoke very highly of what the academy has given them. And the first time that I discovered about TACT was from one of the such students, such alumni, who gave me an insight on how big the clinical training is as an opportunity in the country. If India as a country has to grow and become the powerhouse, as Prime Minister Modi has mentioned, by 2047, if we have to become a developed nation, the underlying success story will be of our clinicians becoming better trained and our allied healthcare workers becoming skilled not only at saving lives, but at acquiring a lot of other skills that are set up. As one of the largest operators of ambulances and emergency response systems in the country, we work with over 100 hospitals. One of the most acute needs that we felt was for skilled and well-trained manpower. And with TACT and Red Health joining hands today, we are starting on a journey of taking the TACT model and scaling it across the country and enabling students not only in Chennai or Tamil Nadu, but students across the country to have extremely high quality clinical education available and accessible in their cities. Our goal, our long-term vision around clinical training is that it should be nearby in the city and it should be extremely high quality, something that Dr. Ramakrishna and his team, Dr. Santil and his team together have built up in Chennai, and something that's known across the world today.
It is indeed a very, very special day for all of us at TACT and at Red Health. Interestingly, TACT was started also in January in 2007, and we have completed 18 years. 18 years is also a coincidence because I think now it's legally an adult, so ready to fly the wings and grow much more than what we envisioned in the beginning. So when we started, the vision was to transform healthcare and develop a new way of teaching people using simulation, using small group models, using interactive models. And as Pradeep was mentioning, we have trained well over 100,000 people in several short-term courses, and this includes doctors, nurses, paramedics, and even general public on life support courses. So we have trained a lot of people, but now we are ready to fly, and together with Red Health, we really want to grow not only to other cities, but hopefully to other countries as well. And not only with short courses, but also longer-term courses that could offer vocational training, diplomas, vocational training degrees, along with larger university partnerships. So our vision has, 1 + 1 is never 2. So with TACT and Red, the vision has multiplied several fold, and we're really hoping to take this training for clinical personnel in emergency care and critical care to a whole new level. Dr. Sindel has also been with us as the director of TACT right from the beginning. So 5 of us together started this in 2007. So we've come a long way. Yes, it is emotional to let a baby go, but the baby is not going anywhere. We are going to fly with the baby, and as I said, really the idea is I'm going to stay with the organization as a non-executive director and also as an advisor and mentor, and I'm really looking forward to this collaboration to take this to a whole new level. For example, we do courses from American Heart Association. So life support courses, basic life support, advanced life support. We also do a course called Advanced Trauma Life Support. This is from American College of Surgeons. We do a course that is very comprehensive, teaching critical care skills, and that's accredited by a university from Hong Kong. So we are having several courses already that are short-term, that are accredited by foreign organizations. But the goal right now, as we are moving forward, is we will have several Indian and international universities who will accredit and collaborate.
So how many courses you are planning to have?
So instead of, I wouldn't say the numbers, like as I said, the focus is on whatever is required for nurses, paramedics, doctors to handle an emergency. I wouldn't just go by number of courses. I would just say we understand the market, whatever is the need, and we want to start as many courses with variable duration. As I said, everything doesn't have to be long term. Some are short term, some will be long term. That's the plan as we move forward. We will have, we were just discussing about it, we were discussing that we will have an academic board that would, come up with ideas on what are all the necessary courses. With this background, whatever we are already doing will continue. That is the easy part. But now the bigger thing, and not only are we going to do it here, now we are going to do it all over. That's the bigger.
Just to add to what Dr. Ramakrishnan sir is saying, yes, the first focus is the life support courses, which is a 2 or 3 day program which allows people to ramp up their skills, immediate life-saving skills. We also have a few 3-month and 6-month certificate programs planned wherein people who are not very confident about their skills, we will ensure that they become more confident in hand skills and are not shivering when they're giving patient care or trembling with fear. So this is also important. We also plan to take these courses for people who have just finished their 12th standard and are interested in a course in pre-hospital care as their future career. So we are talking to different universities who can help us with these courses. We also want to be able to help people do management, administration of pre-hospital care. Now we know healthcare management inside a hospital, but what about outside a hospital, where ambulance services exist, where other healthcare services exist? So the academic board, like Ramakrishnan sir said, will help us decide what is the right course for what setting, who is the right target audience for this, and we will decide on these courses and take it forward. That is our goal going forward across all cities in India with our plan.
Are you talking with any government for skill development?
We have started speaking to government bodies. Just to name one, we have sent a proposal to Andhra Pradesh Skill Development Council to partner with us in having some of the students from that state get trained in the programs that we are building. And I'm confident that over the next 6 to 12 months, there will be more government / quasi-governmental bodies that we will collaborate with to ensure that more and more students get access to our programs.
What about the curriculum? Curriculum will be set by you or from your tie-up university?
It depends. Broadly, to answer that question, if we divide all programs into 2 buckets, bucket 1 being short-term skilling courses, the curriculum is largely defined by well-known global bodies, like Dr. Ramakrishnan mentioned. There is American Heart Association, American College of Surgeons, etc., which already have a curriculum. And the point there is how, with what level of quality that curriculum can be followed. So the beauty is in the implementation. So we are going to have high quality centers which follow the curriculum to the T. The second bucket, which is the long-term programs, which could be, let's say, from an year to, let's say, 4 years, depending on what kind of program it is, a UG program or a PG program. Those programs, the curriculum will be co-developed with the university that we partner with. So whatever UG and PG programs we are going to offer,
they're going to be in collaboration with the university as per the laws of the land, and therefore the curriculum will also be co-developed with that particular university.
Which are the cities you are planning to expand, and what is the investment that you are going to do?
First of all, we are going to double down on Chennai. Beyond Chennai, we are going to immediately focus on Bangalore and Hyderabad at the very start. And then during the later part of the year, which is 2025, our focus is going to be on 3 more key cities, Calcutta, Delhi and Bombay. As far as the investment outlay is concerned, difficult for me to quote numbers right now, but you may see us following 2 different pathways. One is a string of pearls strategy, wherein we may bring in 1 or 2 key high quality training institutions under the Red Health umbrella, like we are doing, like we are announcing today. And the second pathway is collaboration with universities to offer long-term programs. So those are the 2 pathways you will see. In terms of investment, I will not be able to share a number right now. However, whichever city we go to, we will of course invest in building a high quality center. So it will involve both CAPEX in terms of equipment investment and OPEX in terms of the kind of trainers that we employ to deliver the courses there.
Are you going to open training centers on your own, or you have to have tie-up with local training centers?
We are open to all opportunities that present themselves, and even as we conduct this meeting, we are exploring all options. So it really depends on what best comes our way for a particular city. We are not bent on doing it one way or another. Whatever is the opportunity comes along the way, we will evaluate it objectively. There is also a huge target audience for industrial and corporate trainings across the world. Even if we talk about India, a lot of organizations that you see in the FMCG sector, pharma, manufacturing, oil and gas, all these are locations or places where a lot of risk is there, right? So therefore, there is a huge market of training the medical teams as well as the non-medical teams in all of these settings to ensure that they are aptly prepared for any emergencies. So right now, as per the labor codes of India, there are a few compliance requirements which India as a country has, and most of these organizations try to follow it. However, what can really be improved is the quality of many of these programs which we are going to focus on. So just to give you an example, without naming any organization, let's say there is a oil and gas company which has multiple refineries in India. All of these refineries, if we conduct a program on emergency management, trauma management, etc., it essentially prepares the staff there to handle those kind of cases if the opportunity presents itself. So we are going to invest in industrial and corporate trainings as well.
It includes mining also?
Absolutely. You can also think of all the large logistics companies. They have warehouses. Thousands of people work in those warehouses in not the best of conditions. And many of these warehouses are far from the big cities that we have. Therefore, all the more important to have teams there trained to handle emergencies, because if they have to go to a city in an emergency, it will take a lot of time. So the use cases are many.
What is the demand and supply gap of trained personnel?
As per a WHO report, the shortage of healthcare professionals in India is going to be 18 million by 2030, and 50% of that is going to be in India alone. Markets like India, Philippines, and a few others annually export about 30 to 50,000 allied healthcare professionals to other countries like US, UK, many in Africa, Gulf, Australia, Japan, because of the shortage there. So the market is huge. What we need to focus on is building a global center of excellence for allied healthcare education, so that in India as well as abroad, when people look for hiring trained allied healthcare professionals, they can look at us as an organization that can provide that.
Where you are planning to have this center for excellence?
Can you repeat the question?
No, where you are going to have a plan to set up this institute, center of excellence?
It's not going to be a physical building. It's going to be a string of these high quality centers across India. Yeah.
Everybody should know the basics of emergency care. If you really think about it, emergencies can happen anywhere. It can happen here right now. It can happen in a hotel. It can happen in a cinema theater or anywhere. So the general public also needs training on basics of life support and how to handle that and what to do and what not to do in an emergency. So the number of people who need to be trained is endless. I mean, everybody needs to be trained. But what we're trying to focus is identifying groups who are more, involved in this kind of a care, whether it is safety officers in industries, whether it is paramedical professionals, and that helps have their expertise in pre-hospital care. So when you go to a house, even though you may have the knowledge, what you can do sometimes is limited unless you have the right knowledge on doing whatever needs to be done to transport the patient safely to the hospital or wherever the care can be done. So I think the possibilities and opportunities are endless. We need to just focus and channel initially on training more and more high quality professionals in providing pre-hospital care, in-hospital care, and also care in any area that's prone to illness.
For 18 years, TACT Academy of Clinical Training has been at the forefront of training professionals in allied healthcare. These courses have brought some of the best paramedics on ground. We actually employ a lot of people at Red Health that have gone through the excellent training that TACT is known for. Today, it is moment of pride for us. It's a momentous occasion for us at Red Health to be able to acquire a majority stake in TACT, and also bring Dr. Ramakrishnan as a non-executive director, a mentor and a friend, to make the combined entity Red TACT scale across the country. From one center in Chennai, we'll take it across the country, keeping the same ethos of excellence, and making sure that we, as India grows up to become a developed country, the underpinning will be the healthcare professionals who will manage emergencies for us. And I am very confident that this collaboration, this strategic investment, will empower all of us to save even more lives together.
I'm Dr. Ramakrishnan. I, along with a few of my dear friends and colleagues, doctors, we started TACT Academy for Clinical Training in 2007. It's got a lot of distinctions. It is the first simulation-based healthcare training center started in the country. In fact, it's listed in Limca Book of Records for that reason. And over the years, our vision was to transform emergency and critical care education and training. What we were trying to do was using simulators to train in small group interactive models so that everybody learns the skills without any hesitations while they are in the small groups. So we have had several accreditations, national and international. We've been conducting several what we call short-term courses, which are accredited by American Heart Association, accredited by Indian Resuscitation Council, University of Hong Kong, American Society of Surgeons. So there are different programs that we have been conducting, and most of this has been from our Chennai center. Of course, we used to travel and conduct in other places, but we felt that the time has come, and I would say that 18 years has been a journey, but I would also believe that when the time comes, 18 just happens to be a good coincidence, because now TACT is an adult, should fly more. And so the idea is now, how can we take this much farther, reach much greater heights, And I think it was a perfect opportunity, a strategic investment from Red Health, which is a leader in pre-hospital care, one of the only Joint Commission accredited pre-hospital care organizations. So we felt that coming together, we can train many more people, not just in Chennai, but the strategic investment would allow us to start more centers straight away. We're going to consider starting at least 2 or 3 more centers in the next few months. And we are also looking at starting new courses, not only short term, but long-term courses with affiliations with universities. So I think in the next few years, you would hear the Red TACT name a lot more with anything to do with emergency and critical care education and training.
Okay, thank you. Fantastic.